Gabrielle Sclafani. Gabrielle is going to be the facilitator for today. I also want to give thanks to RF Yusuf of Islamic Relief USA, who's one of our co-sponsors today, and Musab Sadia from Majlis Ashura here in New York State. And we're going to give them a chance to speak in a minute. This toolkit was developed as a partnership between NIDIS, the New York City Department of Health and Mental Hygiene, and the Fund for Public Health of New York City. Originally, it was written for community leaders. It's been adapted for faith leaders. Specifically, it's also worth noting that we are still probably 10 or so months away from herd immunity in any significant way. And so pandemic preparedness continues to be a need for houses of worship of all faith traditions, and how we look at the role that houses of worship play in keeping people safe and informed about the vaccine, and that's the kind of information that will be shared today. If we look at the road ahead, I'm sure you're all aware of the fact that the vaccine is still very slowly, much more slowly than anticipated, getting out to the public. The federal government has promised to pick up the pace, but what we're trying to do is beat the clock on the spread of the new versions of the vaccine, which spread more rapidly. So we have to be vaccinating at a faster pace than the variants are spreading in order to get in front of the pandemic. And at some point in time, and the science is different, every scientist has a different opinion, so we apologize for that reality. But somewhere between 70 to 80% of the American public needs to be immune for us to achieve herd immunity. So that means they either have to have had the vaccine or they have to have natural immunity because they've had the virus. The challenge at the moment is we have at least 3 new variants of the original virus, which originally there was the Wuhan version, and then there was a strain that came from China and another strain that came from Europe. New York had the European version, but now we have a new English strain, a Brazilian strain, a South African strain. None of them are more deadly, at least at the moment that appears to be the case, but they are significantly more contagious, more than 50% more contagious. So they spread faster. So it's actually more dangerous today to be unprotected, unmasked, not practicing good hygiene than it was back in March and April when New York was devastated by the first wave of the pandemic. So preparedness for congregations, how we worship together, how we do visitation with family and care for the sick within mosque communities in this case, and certainly the social service agencies within the Muslim community as well. This is becoming more important than it even was several months ago. So again, I want to thank you all for joining today. I'm sure more people will climb on to the call over time, but we just want to get started. So I'm going to turn it back to Gabrielle, and she'll take us through the rest of the PowerPoint together. Thank you.
Thank you so much, Peter. I just wanted to give Arif Yusuf, the Disaster Response Manager from Islamic Relief USA, a chance to say a few words.
Hi all, Assalamu alaikum, and peace and blessings be upon everyone. It's great to see everybody, and I just wanted to say, as Peter mentioned, welcome to everybody. We're very glad that you could make the seminar or the webinar for that matter. Welcome, and we appreciate you being here. But I also wanted to give a huge shout out and thank you to Peter Gudaitis and the NIDIS team for developing this toolkit and organizing trainings around the toolkit. More importantly, to go above and beyond to make sure that the toolkit is accessible to all faith communities in New York. So thank you for that. I'm looking forward to the session. So thank you, guys.
Thank you very much for your support. And Mossab Sadia, the outreach manager from Majlis Ashura.
Yes, thank you, Gabriel. And again, I want to thank NIDIS and Peter for putting together this toolkit. As you all know, Majlis Ashura represents 90 plus Masajid and Muslim organizations across the city. So it's, especially important, and Long Island actually. So it's especially important to have toolkits like this readily available for the entire community. And I'm looking forward to how we're able to get ahead of the clock. Majlis has been working with, I know, NIDIS, but also other facets of city government to make sure we're on top of the ball when it comes to coordinating between the government and the Muslim community regarding the pandemic. And we're excited to continue working together, inshallah. Thank you.
Thank you. To get us started, I wanted to give a quick overview on Zoom controls. You're going to find your controls at the top of the screen. The webinar is being recorded, and please mute yourself, as most of you have already done when you're not speaking. If you do have technical difficulties, you can put a note in the chat or email my colleague Susan Polewski, our facilitator. She'll help you out. You'll get an evaluation after the webinar, and if you fill that evaluation out, then you'll be emailed a link to a full recording of the webinar, and we will be sharing the PowerPoint slides with you afterward as well. So a brief overview of what we're going to do today. The majority of this webinar is on the toolkit, and we'll go over that in detail. You'll have a chance to ask questions about the toolkit. I'll share some additional resources for religious leaders developed both by NISN and by partner organizations. And then we'll hear some vaccine updates, including a moment with Lou Rivera from the Department of Health and a chance to ask questions in that regard. Before we get started, we wanted to ask you, is your congregation or community using a written emergency plan during this pandemic? A poll should pop up for you. Yesterday, when we were doing this webinar with a group of Christian leaders, we found that 50% were using an written emergency plan, and that all of those communities had developed that plan after COVID. So the pandemic had kind of spurred them into creating the plan. I see that the votes are rolling in. All right, we have 3 yeses, 2 in progress so far. We'll wait another moment. All right, 60% yes, 40% in progress. I'm curious, for those yeses, was that a plan that you had already before the pandemic or something that you recently developed?
I can speak on behalf of Islamic Relief USA. That was a plan once we found out that the pandemic is going to be an issue. We quickly developed a plan. It was back in the end of 2019. So we put that plan in place and really rolled it out in February and March of 2020.
Awesome, thank you.
As far as I know from Majlis Ashura, they developed a sort of plan in February when it looked like a lockdown was going to be imminent. And they started getting that out to Masajid as soon as a week before the lockdown.
Okay, wow, that's great proactivity. And I see that some communities are still working on getting something together that can help them through the rest of the pandemic. All right. So we've adapted this toolkit. It was something that was developed by the Department of Health and Mental Hygiene, in which we adapted specifically for the New York City faith sector to include considerations for all of the diverse stakeholders that you serve. And we include a lot of easy to use worksheets so that this is an extremely practical guide that you can use in your day-to-day operations. This is just a quick overview of where to find some important sections within the toolkit, and an image showing an example of a page. You'll see that the blue top boxes indicate where to find templates that are really useful for sharing information with your congregation, and the gray boxes are for cross-referencing to other pages. So before you can plan this kind of communication, you need to identify the different groups that you're communicating with. This usually breaks down into two categories. For religious communities, you'll have your leadership and your staff, and then you'll have your congregants, clients, and contacts. And it's important that we're adapting communications based on our audience. This is an example of how to use an organizational chart to help identify the structure that your organization is using to organize its leadership and the way that decisions get made, and it can be easily adapted to any community. When you're determining what types of communication are most appropriate for your leadership and staff, there's a wide number of topics that you want to keep in mind. That includes continuity of operations. So if someone falls ill, who's going to step in to make sure things continue running seamlessly? Delegation of authority, who is qualified if key leadership is not available? What happens when people get sick? Are there policies that allow them to stay at home or to work at home? Information about the vaccine now that we have it. How are staff accessing training, both about COVID-specific activities and training activities in general that might not be able to happen as normally planned? How are you helping your staff's family and loved ones stay prepared? And what kind of general hygiene information do we need posted and accessible in terms of hand washing, and the big one for COVID-19, of course, masks? These communications, of course, will change when communicating with congregants, clients, and contacts. With them, we need to be clear about what changes are happening to services and programs. How is prayer being conducted during this time? Is the mosque or community center open at the same times as normal, or are there special hours of operation? Is there personal protective equipment available for all of the staff and leadership if they do have in-person activities going on, as well as anyone attending? And then some of the same information that we want to share with the leadership and staff, with additional service information in terms of how the government and other organizations, whether they're partners or organizations in the community, are helping people during this time of pandemic. After identifying these groups, it's important to consider how this information will be communicated, and that might differ depending on the groups. You can use social media, of course. I'm sure a lot of people are depending on email, and as well as direct conversations in some case when we are working together in person, or whether we're having Zoom calls with one another. And for congregants, clients, and contacts, sometimes we need more group communication styles like mass emails or mailing. We'll post updates on relevant websites to make sure that people can keep themselves informed easily. Print materials like flyers or posters might also come in handy, especially with populations that are not particularly online. And of course, the communication method that we're using right now in the form of a webinar. At this point in the pandemic, I know you all have been on 1,000 webinars, and that you're really experts in adjusting services for this type of situation. And I'm hoping that this will be a time where we can share the best practices that folks have developed over the year in order to meet the needs of their community. Our next poll question is, what forms of communication have you used during the pandemic? And you can check all that apply. For me, I found that email has worked really well during the pandemic, as well as Zoom. We're getting some answers that show similar results. Excellent. I'm seeing a lot of social media, conference calls. All right, great. So email and social media are the clear winners, followed closely by conference calls. Does anybody want to share if there have been any particular communication strategies that have worked especially well for you that would be helpful for colleagues to know about, whether they're social media strategies or ways of increasing participation when we're digital only? We had some conversations earlier today about how Facebook, in terms of social media, tends to work better for older populations, whereas Instagram and Twitter might appeal more to younger populations.
Yes, hi, this is, I am Rahman. I agree. I think we found that Facebook was good for sort of the, I'd say, 35 to 55 range, but even the robocalls are more useful for those, let's say, in the elderly community, 65 plus. So different mode of communication was important for us to maintain that connection with different constituent groups within the community.
Absolutely. And that's a great thing for NIDIS's How Alert system, helps people to make those calls in case of emergency when a large group of people needs to be communicated with all at once, and especially with older populations. It's really great to have a system in place for that. Thank you, I am. Okay, moving forward. In terms of the supplemental documents that are available within the toolkit, you'll find that there are a lot of message templates and guides on writing such messages. And there's a few overarching principles that we want to keep in mind in crafting this type of communication. And those are positive action steps, having an honest and open tone that encourages people to trust in what's being communicated, the accuracy of that information, its clarity. It's really important that the communication is double checked within the staff to make sure that it's really clear, simple words, short sentences, and that we're avoiding any kind of jargon and abbreviations, judgment, humor, or extreme speculation, kind of doomsday thinking that we don't have evidence for. And it's also important that we're remembering what's been going on in a particular community as we form this communication. So if your community has been particularly hard hit by COVID, or there have been recent deaths, how are you adapting your communications in order to be sensitive to that reality? For planning communications, we have this chart that can help you to organize that and make sure that you're checking all the boxes in terms of what you're communicating and acknowledging the impact of the pandemic to that particular community. Some of the other templates that the toolkit includes are get ready for COVID-19, if you're not feeling well, staying healthy, and changes in congregational programming. During a pandemic, the celebrations, rituals, and ceremonies, weddings, rites of passage, observance of holy days that your community ordinarily counts on will require creative and patient reworking. Plan ahead for how you will maintain as effectively as possible the required rituals like prayer, study, and worship that give meaning, structure, and dimension to your community life. Part of this planning process is planning for continuity. And when we're planning for continuity, we want to be able to identify our essential functions, whatever the organization's doing that cannot be put off, An order of succession is also really helpful, which I'm sure a lot of your organizations already have in terms of who's in charge of completing essential functions if the leader becomes unavailable. And then delegation of authority, who can spread out those responsibilities when one person is overburdened or unavailable. Like we said, the essential functions are those that have to be performed right away, and non-essential functions, or whatever is extra, can be put off, be it for a few days or a longer period of time. And mission essential functions are those that are directly related to accomplishing your mission, be it spiritual, practical, or both. And the support activities are those that support that mission. An example of a mission essential function in a house of worship would be ritual life, regular prayer service. And an essential supporting activity would be the maintenance of any kind of items that are used for that worship service, such as prayer books, sacred texts, and garments. A deferrable mission or function might be religious education. This is important, of course, in the long-term life of a community, but can it be put off until the situation calms down? And a deferrable supporting activity would be all the nuts and bolts of that program. So in this case, class rosters, supplies, paying teachers, etc. I know that a lot of religious communities stopped religious education toward the beginning of the pandemic, but since then have found ways to creatively reintegrate it. Other essential functions can include providing spiritual, emotional, and social support, prayer services, of course, social services for special populations, rituals related to death and dying, birth and cleansing, as well as wedding ceremonies. I'm sure many of you have heard the news that weddings are going to be restarting in New York coming up in March and April. In the case of a disaster, and in particular a pandemic, other essential services might be promoting coping and safe practices among staff and those you serve, disaster-specific personal self-care practices, recruiting people who are specially trained in order to give that type of care, practicing reciprocity between other faith communities to provide essential services to make sure that no one community or one leader is bearing too much of the responsibility. And communicating risk, as we've talked about and as I am given an example of, is really important, that we can offer timely and accurate information that seeks to inspire, inform, and educate, and that we meet fear and anxiety with empathy, reassurance, and calm, and that we're not contributing to any kind of rumors or misinformation, and also that our congregations know that you've given them approval to practice their religion in a safer way. If that means not coming to Friday prayer service, or a Friday prayer service isn't happening, that people feel that it is okay that they're worshiping at home. Our next poll: does your congregation have an order of succession or delegation of authority plan? This is another one that I think a lot of congregations have started implementing post-pandemic, when they've realized that it's very likely that an important or key staff member could become indisposed. I'm seeing some answers rolling in, getting a lot of yeses. This is excellent preparedness. All right, so far we're at 100% yes. All right, and that's the poll. So we have an exceptionally prepared group today. I'm curious again, did you all develop that order of succession or delegation of authority plan before or after the pandemic hit?
This is RF. I can speak for my local mosque. That plan was in place way before the pandemic, in terms of, who's in charge after, if anyone needed to step down. So it was well in place for that. And obviously with Islamic Relief USA, it was also in place way before the pandemic.
Great.
Hi, my name is Bibi, and I represent Bay Ridge Community Center, and today also Islamic Society of Bay Ridge. Thank you for this very informative meeting. One of the things that Islamic Society of Bay Ridge has done, and always, has done, is that I think all Muslim communities is that we have we have a group of people, right? It's not just, our leadership is not just one person. It's generally a group of people. And so it's well known within the community, who's the, first person and who's the second and third to go to in a situation like this.
Thank you, Bibi. That's really great that it's a group making those decisions and mutually accountable for it. Great. So if you don't have a order of succession plan, then there's a chart on page 53 that can help you set that up. This is an example of this type of chart for a congregation with social services. So we've got the director of sacred music over here. We've defined their function. And then we want to list not just one person who could take over in case they become unavailable, but in this case, we're listing 3 alternates so that we know exactly right down the line if more than one person is unavailable, who's up next. And we've done the same thing for the manager of the congregation's feeding program. Here we have a special note about volunteers. Volunteers present unique challenges during an emergency. Many have regular paying jobs which they must perform. They may use their free time or time off to conduct their voluntary activities and may be unavailable to perform those duties even if they aren't ill, but because their regular job has more need of them because of the pandemic. I'm sure that many of you have encountered this situation with volunteers at this time, especially as so many people, so often our volunteer communities consist primarily of women who might be burdened with childcare during this time. If your congregation relies heavily on volunteers, then it's important that you're communicating with them during this time and that you're reinforcing messages about preparedness and planning for their households, finding out if they need assistance and whether they're available to help when needed. It's also possible that your volunteer population is elderly and could be in the high risk category, and that's something that you might want to watch out for on their behalf. Checking in to see if they're able to continue their work and if they have any healthcare concerns that are troubling them. In terms of planning for staff, prevention is definitely one of the most effective methods to ensure that staff continue being available. Measures that you can do to prevent the spread would be a campaign promoting healthy activities, getting your information from reliable sources such as the CDC and Department of Health, encouraging vaccinations now that they're available, as well as all of that great social distancing and hand washing, masking, everything we know prevents the spread of COVID-19, easy to find policies, and also it's helpful to consider altering policies that rely heavily on actually seeking care, such as getting a doctor's note from a practitioner, because these can burden our already stressed system during a pandemic. This is also a good time to reevaluate whether staff are being cross-trained and can easily pick up someone else's responsibilities in case they're out or if there's a change in the staff. And if your congregation or partner organizations provides medical, mental health, or spiritual or pastoral care, it's a great time to republicize that information and make sure that people are aware of all the benefits that they have access to. In terms of worship and religious gathering, at this time, as I'm sure you've all contended with, it's important to consider canceling large events and developing plans for alternatives. Zoom, like we're doing now, pre-recorded video sermons, email communications. And if you are holding events in person, are you staggering or limiting attendance to create physical distance between participants? Are you adapting traditions that require physical contact, like handshaking? And if you've changed the location of your services, Are you sure that that location is accessible to everybody who is normally part of your congregation? And this goes the same for online worship services. Sometimes online worship can create unique challenges for folks who are blind or hearing impaired, and it's important that we have descriptions of videos as well as subtitles to help make that information and experience accessible for everybody. It's also possible during a pandemic that there can be disruptions in the food supply chain that can make it difficult to access special foods that are needed for religious dietary needs. What kind of options are you making available to your congregation to cope with those changes? And as a religious leader, you will need to help those who seek your care to reflect on what happened, name and grieve losses, explore doubts and questions about beliefs, and to participate in commemorative events and healing rituals and express emotions. Are you available to your congregation for these activities? How are you creating spaces to really name our feelings and to grieve? You might see a need to deliver food to the sick, to offer rituals of healing, to visit the dying in a hospital, and to help with mortuary arrangements. All of these activities while dealing with the emotional needs of grieving families. What are you doing to protect yourself when you're making those visits? Sometimes an in-person visit, especially when we're talking about death and dying, might be necessary. Do you have the personal protective equipment you and your staff need in order to keep yourself safe while making those calls? Funerals, particularly, may need to be adapted during this time. It's very possible that you're performing funerals for folks for whom you're also going to be doing a kind of memorial service a year or two down the line after the pandemic passes, because it is so important for people to come together physically when grieving, and the Zoom service might not be enough for the individual's family and loved ones. It's important to plan for increased demand of all kinds of pastoral care type services during this time, as well as ritual services like funerals. And a way that you can help to meet this increased demand is to offer alternate rituals and services when we're not able to gather in person, whether those are created by your own community or created by other mosques and the global Muslim community. Developing partnerships with other faith communities to provide essential social services or ritual life can also be really, really helpful when folks are operating at a reduced capacity. And it's important to alter rituals that require bodily contact or shared vessels. We're already adopting funerals when, in terms of a alternate protocol for birth rituals. That might mean waiting, that might mean doing something virtual. And it's important to develop a protocol as to when it's necessary to temporarily suspend daily operations in order to focus on the people who need the most support right now, which is probably the sick, those who are grieving, and congregants who have developed special needs because of the pandemic, like newly orphaned children or folks who have become homebound as a result of the pandemic. Are they able to access everything they need from home? This is a time that you can share in the chat or simply call out is great. How has your congregation adjusted your services and rituals throughout the pandemic? Are you holding services over Zoom? What does religious school look like? How do you celebrate life events? And what resources do you provide congregants to help them worship or practice at home? I personally have been to a lot of Zoom worship services, as well as a number of Facebook Live and YouTube worship services. I have opinions about which one of those works better for me and my worship needs, and I'm finding that every community has their own preference for what medium works best.
I'll share a little bit. So a lot of the worship services that are done or performed in congregation are required to be in the same physical area in the Muslim community. So for those worship services we have at the mosque that I'm representing here at the As-Sadiq Muslim Organization, we've maintained social distancing, masks, and COVID protocols to ensure that we can continue to safely practice those items. Then there are what I would call more social and motivational kind of worship services that would be more educational, but also helping to provide context and education for the congregation in general. We've definitely done a lot of those on various media channels, right? Whether it's Zoom, Facebook, YouTube. So quite a few of those that include things like, mental health and other motivational topics to keep people's spirits up and so on. Religious schools, we have also used Google Classroom and the like to maintain some of those educational activities as well.
Thank you. That sounds like it's a really robust profile of programs and services that you're offering, and it's great that you've been able to adapt in-person worship in a way that feels safe for you and your community. Anybody else want to chime in? All right, we can move forward. I think that Ayam gave us an answer that is really comprehensive, and I bet a lot of people are using strategies like he described. Another aspect of planning for continuity is congregational and household planning. So if a staff member does become ill, of course, it's important to give them time off or let them work from home. And if a congregant has become ill, although of course emphasizing that they're missed and that you really want them to be there, it might be appropriate to request that they stay home and miss that week's worship service rather than coming while infected, because that would be a violation of the quarantine rules for those who are positive. Those who become ill should get the following guidance: concrete information on how long they should remain at home based on whatever the local health department is saying, making sure others in their household are also staying home when they're sick, sharing information about basic supplies that are helpful to have at home, and relevant city, state, or government programs. We have Test and Trace Corps in New York City. Every local community has some kind of response happening right now. So what is most helpful for yours? Special considerations that we need to make in terms of supplies and equipment. Of course, PPE, we've all got masks. Some of us also have gloves and goggles to keep us safe. What kind of technology needs are coming up at this time? For example, at the beginning of the pandemic, NIDIS and a lot of other organizations invested in Zoom subscriptions, some of us for the first time. What technology works for you? And of course, other hygiene supplies, cleaning supplies, hand sanitizer, etc. Thankfully, I think we're past the time of hand sanitizer shortages, toilet paper shortages, but toward the beginning, those were things that everybody had in mind. And also ritual items or materials that might need to be delivered to folks who are, for whatever reason, unable to leave their house. In terms of additional cost, it's important to remember that none of the actions taken in the previous sections can be successfully performed unless you plan for the costs. Additional supplies, communications, overtime, or anything else may have costs associated that your congregation or faith-based organization may be challenged to afford. It's important to consider those costs when preparing and responding, considering the frequency of the costs, as well as income that might be lost during the pandemic through lost rent or reduced donations. Before you proceed with making any kind of investments in response to the pandemic, it's important to answer the following question. Does your staff need this to continue to function? Will not having it put people's health at risk? Is your action or purchase based on facts, and will the community actually use this? At the beginning of the pandemic, NIDIS had invested in a Zoom subscription that included a webinar license. And what we found over time is that that webinar license wasn't actually necessary for conducting the size of events. So we were able to scale back our subscription and save a little bit of money. Do you have any places where you might have over prepared and can now cut back? Mental and spiritual health are an important consideration when planning for continuity. During a pandemic, it's a time of high stress. Everybody's kind of on edge. You can encourage staff to look to one another for emotional support. You might consider instituting a buddy system where each staff member can be assigned or choose someone to provide peer psychological, emotional, and spiritual support. Other self-care tips that might help you and your staff: taking care of your body. This includes sleep and rest, eating healthy, exercise, avoiding drugs and excessive drinking and smoking, of course. Exercise has been a really important one for me in terms of staying healthy, making sure that I get outside and walk every day. Taking care of your mental health, learn about normal and abnormal reactions to disasters, and don't ignore your own emotions. Know when to seek help. I'll show you our Thrive toolkit later. That is a really helpful resource for mental health responses. Taking care of your spiritual self. Do you have time to reflect, meditate? Are you able to maintain your prayer schedule? Are you able to find connection and community? And increasing resiliency. Doing something that will help you to regain a sense of control, focus on strengths and positive coping skills. Reaching out is something that has been a challenge for some folks because we're not running into each other anymore, and reaching out means picking up the phone or typing something on the computer, which can create anxiety. But are you making a practice of reaching out when you need it? Remaining active, having a routine is really helpful in staying busy in a way that feels healthy. Managing your workload. Are you able to keep a balance between work and rest? Especially as many folks are working from home, it's easy for the boundaries there to bleed. What are you doing to create time for yourself? And reducing stress, things that you find comforting, of course, exercise, reading, listening to music, being with loved ones, and practicing stress reducing exercises. I see that our representative from the Department of Health and Mental Hygiene has joined us. So I'm excited to hear his updates on the vaccine soon. These actions might help leadership to delegate. You know, at a time like this, a lot of responsibility floods to the top. So do you work with a judicatory, a religious network, or a partner? Maybe a congregation that has a similar mission can share some of the leadership responsibilities at this time. It's important to combine activity in a way that allows leadership to split time and feel less stretched. If your congregation has different branches, can those in a less affected area come in to help? At this point in the pandemic, COVID is so widespread that that might not be an option anymore. And is it possible for leadership to work in set rotating shifts so that everybody has a agreed upon time off? New York City Well offers some really helpful tips for recognizing stress and staying mentally healthy. You can follow this URL, which will be in the PowerPoint that we send to you. Self-care is really important, of course, and our question is, how have you been practicing self-care throughout the COVID-19 pandemic? And what policies or practices have you put in place to encourage self-care among your staff? You can call out or write it in the chat. I've shared with you that exercise has been really important, those daily walks. I also try to make time for stretching and maintaining my own spiritual practice and ritual. My colleague Susan shared that she's been taking walks and regularly calling friends to catch up. RF shared that he's also taking walks. I know other people are spending more time with their furry friends, cats and dogs that they might have at home or in the community. Arif's also reading more often as well. Hanetti shared that, like Susan, she's trying to keep in contact with friends she might have lost touch with. Thank you. These are really great answers. I'm glad to see that everybody has developed strategies for taking care of themselves. Jahan shared that he's been playing with his cats. Lovely. I really appreciate this. This is just a visual for some of the supplemental documents that are available in terms of continuity planning and communications planning. And now we have some time for questions. If there's anything that was unclear or that you'd like clarification on, this is the time to raise your voice or chat, type in the chat. All right, if anything comes up for folks, then you're also welcome to put that in the evaluation or to write after the fact. I have a few additional resources that I'd like to share with you before we turn it over to Lou Rivera from the Department of Health and Mental Hygiene. I first want to make sure that you're all aware of NIDAS's website and social media. We've been posting real-time updates on Facebook in terms of everything COVID-19 related that NIDAS is doing, as well as general situational awareness. We're also very active on Twitter, and that you can repost those updates in order to share information more easily. Our website is maintained regularly, and we have a lot of COVID-19 resources and resources specific to houses of worship available there. I mentioned our How Alert, House of Worship alert system a little bit earlier. This is a free crisis and emergency risk communication tool that's specifically designed for you. It includes information on how and when you want to share messages, and it can send information about life-threatening and urgent situations by email, text, or voice. So I think it was Ayam or Arif who mentioned that for older congregants, voice message is by far the best option. So this is a really easy way to communicate via voice with a large group of people simultaneously. And people who receive that communication can respond by completing online forms and submitting requests for help. There's a link in this PowerPoint slide to register for How Alert that will be really easily accessible when you have the PowerPoint on your own computer. I want to make sure you're aware of the other upcoming webinars in this series. We have one tomorrow for Buddhist and Hindu leaders, in case you have any Buddhist and Hindu colleagues. We have a webinar in Spanish for Christian Spanish leaders coming up on Tuesday. And next Thursday, we have a webinar for leaders of any tradition. So if you have any colleagues who couldn't make it today but wanted to, they are more than welcome to join us a week from tomorrow. Here's that Thrive NYC Pandemic Mental Health Toolkit that I mentioned. It's a great resource for helping you help others, including those who are struggling with all the accumulation of challenging emotions that come during a pandemic. Helps you restore that balance between physical, mental, spiritual, and emotional well-being, better face the reality of COVID, and direct people to the appropriate resources and refer individuals to mental health care providers as is so often necessary at a time like this. And there's also a link to download this toolkit. We have tip sheets available on our website under the resources tab. These include self-care for religious leaders, disaster mental health, disaster and crisis spiritual care, the continuity of operations planning, which is a big part of our conversation today, and risk communications, of course. This is our Disasters and Religions app, which includes religious literacy and competency resources for disaster readiness, response, and recovery. You can download it on your phone. These are some of our partner organizations' resources. There's a Frontline Essential Workers hotline. Frontline workers have been especially stressed during the pandemic, And this is a line designed for them to get the support that they need. Vibrant Emotional Help and the Coalition for Behavioral Health developed this line. There's the Disaster Distress Helpline, which is a national line, as well as NYC Well. They have, in addition to their website, a call, text, and chat function, and that is available 24/7 in more than 200 languages. So that's a great option when you have a diverse multilingual community. The National Suicide Prevention Lifeline is an important thing to have posted in houses of worship, because this is a time when mental health emergencies have been increasing and people need care in order to prevent suicide and untimely deaths. The National Domestic Violence Hotline, we also know that reports of domestic violence have increased during the pandemic because folks are spending so much time closed in together, and it's important that folks are aware that there's a hotline available to them during those times. An important resource that the Department of Health offers during COVID-19 is the isolation hotel program. So if you do test positive or a congregant tests positive and they don't have a safe place to isolate because they're living with others, there's only one bathroom, or if there's someone in the household who is healthy and doesn't want to get COVID, in both cases, they might have access to the isolation hotel program, and you can stay free of charge for up to 14 days in order to keep yourself safe and those around you. We're now reaching the time in our webinar that we've set aside for vaccine updates. Lou, would you like to take it over from here? We also have some slides that either one of us can go through if you'd like to give a little more content first.
Hi, this is Lou. I came prepared just to speak generally about vaccines. Did you say you created slides to talk about them?
We're actually primarily using a Department of Health and Mental Hygiene deck, and I am happy to go through it and then let folks ask you questions afterward. Does that sound good?
Yeah, that's fine. Thank you.
Sure. So we have 2 COVID-19 vaccines currently available. They've both been approved for emergency use by the FDA. These are the Pfizer vaccine and the Moderna vaccine. And in clinical studies, both were more than 94% effective at preventing what is termed laboratory confirmed COVID-19 illness in people who received 2 doses of the vaccine without evidence of previous infection. It's a very specific term, but what that means, according to the CDC and to the Pfizer study, is that it's 94% effective in preventing people from then getting COVID such that they test positive and have 1 or more symptoms. That's the definition they're using of laboratory confirmed. This slide shows us how a new vaccine, be it for COVID or anything else, is developed, approved, and manufactured. You see that the phases of clinical trials move from a very small phase with 20 to 100 volunteers to phase 3, where there are hundreds or thousands of volunteers. In the case of both COVID vaccines that are available, those numbers were in the tens of thousands. And the FDA is not giving out licenses easily. There are really stringent requirements in terms of how the vaccines are produced and quality control. They're made in batches called lots. All of those lots are tested for safety and potency. And the FDA regularly inspects manufacturing facilities to ensure safety and quality. Are the vaccines safe? Both have gone through large clinical studies with tens of thousands of people of various ages, races, and ethnicities. That Pfizer study had over 44,000 volunteers, and the Moderna study had over 33,000 volunteers. And all of the evidence was closely reviewed by the FDA as well as independent organizations. This is a racial breakdown of the Pfizer-BioNTech vaccine trial. They tried to get a group that mirrored the US population. They weren't able to get the exact numbers, but it is one of the most racially diverse vaccine trials in US history. Moderna achieved similar demographics, And there's no evidence that the vaccine is differently effective in people based on race or ethnicity. There's nothing to support those kinds of claims. In terms of gender, you'll see that the study groups were pretty evenly distributed between genders and as well as in terms of age. You can't get COVID from the vaccine. It doesn't contain the virus. It teaches your body's immune system how to fight the virus, so it can fight the virus if you're exposed. And researchers have been working on coronaviruses for years. So even though it was called Operation Warp Speed, they weren't starting from scratch. And it's important to understand that while mRNA is new in terms of vaccine technology, it has been studied for over 30 years. As of Monday, January 11th, and this is still true today, the following groups are eligible: at-risk healthcare workers, folks 65 and older, residents and staff in nursing homes and certain other group living facilities, and certain frontline essential workers, such as first responders, teachers and school staff, daycare workers, transit workers, and grocery store workers. And this is the eligibility specifically for New York. So if you're living in another region, your eligibility will be determined regionally. This is just a visual chart of that same information that's available from the Department of Health website. The vaccine is free for everyone. You don't need to share your immigration status to be vaccinated, and it's not a public benefit under the public charge rule. When you receive the vaccine, your privacy will be protected, and there are strict laws in place to ensure confidentiality of your personal information. In order to make an appointment, you want to schedule it in advance. You'll complete the NYS COVID-19 vaccine form in order to get vaccinated. We did hear from our other Department of Health speakers that there had been some issues in terms of the form asking folks for insurance information, even if it's not necessary. So if that happens, you can skip through that, although Lou can confirm yeah, so you can just skip through that. You can schedule your appointment at Vaccine Finder.
Hi, sorry.
Yep.
Just wanted to jump in. So
Please.
If you have insurance, they will bill the vaccines to your insurance. So it's no cost to you, but it's a cost to your insurance. Similarly with how testing was happening in the beginning of COVID. If you don't have insurance, then all you have to say is, I don't have insurance, when you're putting the information into the system. And we'll talk a little bit more about the system when Gabrielle hands it over fully to me. But if you don't have insurance, you say you don't have insurance, and you don't have to put that information in, and you could still proceed with moving forward to get an appointment to be vaccinated.
Great, thank you for clarifying that, Lou. With the Vaccine Finder, it's important for me to note that this is a vaccine finder, so you won't necessarily be able to make your appointment. You might just get information for who you can make your appointment with, whether it's a local pharmacy or another testing site. There's also a phone line you can call for making an appointment. And of course, practicing COVID safe practices when you go to get that appointment in terms of good hygiene and covering your face with a mask. This is an image of the location finder, and you just type in your address, zip code, or you can use GPS and search near me. Each site manages their own appointments, so that's why you're going to be on the phone or going to another link in order to actually make that appointment. The Vaccine Finder is just the location tool. There you go. And this is a track of how vaccinations are going in New York City. To date, as of today, 837,000 doses have been administered, and of those, 618,000 were dose one. So 618,308 people have been vaccinated. Not all have gotten both shots. We have fewer than 104,419 doses on hand. There was a little bit of lag this week because of the snowstorm, but they're getting vaccines out almost as quickly as they're delivered. Potential side effects from the vaccine are soreness or swelling on the arm at the site of injection, headache, body aches, tiredness, and fever. I was on a webinar with Dr. Wayne Riley from SUNY Downstate a few weeks ago, and he said in comparison to the shingles vaccine, which is the worst vaccine he's ever had, that the side effects he experienced from the COVID vaccine were not so bad. They usually set on pretty quickly and last for 1 to 2 days, and they're more common after the second shot and less common in older adults. If you do get side effects, call your healthcare provider if they concern you. Don't go away after a few days, or if the redness or soreness increases rather than decreases after 24 hours. After vaccination, you still do need to practice prevention. The reason being it's unclear if people who are vaccinated might still carry COVID. So you should stay home if you're sick, stay 6 feet away from others, wear a mask like we've already been doing, and continue practicing good hygiene like hand washing. The vaccine is not 100% effective, and we still need to learn how long that protection lasts. Again, if you can be a carrier despite having the vaccination, whether people will need booster shots, all of that will come with time. So you need to stay informed and listen to information from public health officials. In terms of herd immunity, that's what we're aiming for. It means that enough people are protected because they've already had the disease or they've been vaccinated. When we reach herd immunity, there's not enough people available to carry the virus for it to spread easily. So eventually the virus starts to die out within a community. And the percentage of people who need to have protection in order to achieve this varies according to the disease and specifically the transmissibility of the disease, which is why now that this strain from the UK is as much as 50% or more transmissible, that means that potentially we need a higher percentage of the population with antibodies, either from disease history or vaccination, in order to achieve herd immunity. Experts don't know exactly what percentage that will be for COVID-19. We've heard estimates between 70 and 80%. So our last question of today would be, have you gotten a COVID-19 vaccine, or do you know someone who has? What was your or their experience? You can unmute yourself or share that in the chat. I personally have not gotten the vaccine yet, although I've talked with a few friends and colleagues who are healthcare workers who have gotten it and had pretty mild side effects. 1 or 2 people I know have had fatigue and flu-like symptoms, primarily on the day after receiving the vaccine, either for 1 or both doses.
I got the vaccine a few weeks ago, probably like around the middle of January. And I don't know if it's because I was working like 3 days straight standing up at a vaccine center. So my body was already beat to begin with, quite honestly. And so I took the vaccine on my last day of being scheduled to work in a vaccine center because in case I had any side effects, I didn't want to miss out. I didn't want to sort of leave my colleagues high and dry if I would have to call out on my rotation. I will say that almost immediately after I got the vaccine, I got like a slight headache. And then I was just super, super tired. And the next day I needed to just relax. And as long as I just kind of relaxed for a while, I was fine. And that was like a Friday. So I worked like Tuesday, Wednesday, Thursday at the vac center, got vaccinated Thursday, was off on Friday. And by Saturday, I was fine. Or even by Friday night, for the most part, I was fine. By Saturday, I was like back to regular, energy and all that stuff. But those were the symptoms that I experienced from it. But I spoke to some of my other colleagues. Some of them had no sort of side effects whatsoever. But most people, I think, generally had a fatigue after taking it.
Thank you very much for sharing that, Lou. We got a similar response from Ayam. He mentioned that he hasn't received the vaccine, but spoke to someone who did, and they had flu-like symptoms the day after, which is common. I mean, sometimes after getting the flu vaccine, we also get flu-like symptoms the day after. The key is that those symptoms are typically short-lived.
I'll share that I got my mother the vaccine, and she's 93. She had no reaction, no sore arm, I feel like she did better than people half her age. But she's highly allergic to bees and some medications, and she had no allergic reaction to anything, even though that's something she was very worried about. So
Sounds like she did better than I did, Peter.
she did. She's a tough old lady. But no, I mean, I think it was very reassuring to her because I know she was nervous. I know she had a history of allergic reactions to things, but the fact that she just kind of had it and had no problems, I think it not only relieved a lot of her anxiety, but it also helped with a bunch of her friends who were also reluctant, a little bit scared because they're older and feeling vulnerable. But yeah, I think it went really well for her, of course, which I'm very pleased about.
Hi, it's BB again. I have not gotten my vaccine yet, but I'd like to share something that I've been kind of hearing in the community. I'm hearing a lot from community members that they are looking forward to the Johnson & Johnson one-shot vaccine. I would say more so than going and having to do 2 separate vaccines. I do know that in the Muslim community, there is some I want to say wariness about getting vaccinated, as I'm sure in other, communities, especially communities of color. So I do think that it's important to, have talks with the community, with professionals. We do have a lot of, in the Muslim community, a lot of doctors and healthcare workers. We are at Bay Ridge Community, we're trying to schedule, Zoom calls between Maimonides Hospital, and our community members, just to make them feel safe and say, hey, it's okay to get the vaccine, you'll be fine. Just kind of like what Lou and Peter were saying, you might be a little bit, let's say you're older like Peter's mom, but she was okay, or you might feel a little soreness. There is a lot of wariness out there about it. So I think that education is, probably the cornerstone of how we're going to get the vaccine out to our members.
Thank you, BB. I agree with you 100%. And I've also heard folks expressing excitement about the Johnson & Johnson vaccine, even though the efficacy is lower. They feel like, oh, if I can just get one shot, it'll be easier.
Yeah, I think in public health as well, we're looking forward to really seeing how that particular vaccine will roll out, and the efficacy of it and all of that. Although both Moderna and Pfizer have pretty high efficacy, even though it's a 2-step process to be vaccinated. I don't know if you have any more to add, Gabrielle, but by the way, I just want to compliment you. You did great on presenting that material. I thought I was listening to some of my health department colleagues presenting.
I learned it from them.
So just want to compliment you on that. I don't know if you have anything else to add. I can go into some of the points I was just going to discuss, which is just more general information.
I think that you should go for it, Lou.
Okay, thank you. So, I just want to say thank you for allowing me to be here today in this video conference. Thank you to Nidus for making sure that we had the opportunity to meet and to have this forum. It's really important that we get the right information out to our community partners, to our neighbors, to our people that we congregate with in our houses of worship, and things like that. So it is really important to understand that there were no shortcuts done to the efficacy of both the Pfizer and the Moderna vaccines. And I know people are nervous because it was expedited, but it was expedited under an emergency FDA approval process, where actually, quite honestly, I wish they would do this more often for other medications, for other health ailments in the country, where they were able to minimize sort of the political red tape, or the red tape, the administrative red tape that often is involved in approving medications here in the United States that we don't see in other countries, and other countries are able to get medications out sooner to their constituents versus here in the United States. So we were able to show that we can get medication vaccinations out sooner if we can cut through a lot of the bureaucratic red tape that exists in our system. So I think that's why we were able to get this out quicker, and that's where the time was cut. So I just wanted to make sure that you all understood that, because I know there's a lot of concerns, and even for myself in public health, I was like, what? We got this out? Like, well, how can that happen? Because we're so not used to that happening here in the United States that if it happens, then we start to question it, right? So I just wanted to put that out there. I also wanted to just remind everyone that right now, the vaccines are eligible to taxi and limo drivers, restaurant workers, people age 65 and older, teachers, school staff, in-person college instructors, childcare workers, correctional staff, first responders, public transit workers, public-facing grocery store workers, and people working and living in group homes and shelters and other group settings. So the net is getting quite wide at this point. So the minute you become eligible under one of these groups, or if you're eligible already, you should really, start to think about where, if you're gonna take the vaccine, go onto the website that we have. And if you go to www.onenyc.gov, that's our general health department website, where you can find all the information about vaccines that you want, videos, and also the vaccine finder link is there that Gabrielle was talking about earlier. You put in your zip code, as she mentioned, or you could do the sort of find my location option, and it will show you different options on where you can go get vaccinated. That's going to be a mixture of different entities, everywhere from health and hospitals to the Department of Health to private partners, and that are offering or hosting vaccine sites. We have 15 priority neighborhoods as the health department that we have vaccination sites for, and you will see that in the list. It will be identified as health department vaccine pod. It'll say it's going to be attached to a school location, because all of our sites are attached to a school location. But certainly, look at all of your options that you see there to see which one is going to work for you. We are going to be really starting to adhere to some of the New York State policy in and around asking for identification and proof of residency or proof of eligibility that you work in New York City. We want to avoid people. We've had a lot of people come from outside of New York City to receive vaccination in New York City. And we want to make sure that the vaccines that we have are going to either people that live, that reside in New York City, or that work in New York City. So all of that whole category criteria list that I just went over, all of those individuals should either reside in New York City or work in New York City, and they should be on the list of eligibility. So, so we just want to make sure that we're doing that, because obviously, as mentioned earlier, right now vaccine is limited because we're still waiting for the federal government to be able to ensure that we reach that 1.4 million doses or 1.5 million doses a day. So we're not there yet. So we have to make sure that our vaccine supply primarily goes to New York City residents. We will be asking for identification and proof. And we'll work with individuals that may have concerns. I understand, like I'm in my day-to-day role, I'm the Director of Community Engagement and Response. And so I know there are segments of the population that once you mention things like ID, it may deter them from coming in to get services. So we are keeping that in mind and working around those situations. But until the rest of the counties are able to get themselves set up so that they can serve their constituents, we have to make sure that we have some sort of vetting process in place to ensure that these vaccines remain primarily in New York City residents' hands. So that's it. The other thing I want to say is now is not the time to stop doing what you were doing. We have to actually double down on our efforts to make sure we're doing the core 4, which is, you know, making sure that we social distance, that we wash our hands, that we wear our mask, and that we stay home, that we wear face coverings, and that we stay home if we're sick, right? We don't want to go out if we're not feeling well. I understand it's been a very long time. I am absolutely at this point looking for a day where I don't even have to say the word COVID, although I think I'm scarred for life at this point. But so I understand, like, those, like, you know, I was like, oh, I'm gonna get the vaccine and I don't have to worry about this anymore. We are gonna have to worry about this even if we're vaccinated for some time. And I think, you know, Gabrielle mentioned there's a lot that we're still learning about, you know, how long this vaccine will last, you know, whether or not people who got COVID already have long-term sort of resistance, or, you know, not resistance, but immunity to COVID. You know, there are, whether or not we, those who take the vaccine have long-term immunity to COVID, and whether or not both of those groups can actually be carriers, you know, to other people who may not have the vaccine or who haven't had COVID already. So, you know, it's going to be really important that for us not to let our guards down and really work with our community members, with our congregants, with our fellow parishioners, to ensure that they understand that we need to continue to promote the core 4 and to double down on our efforts to prevent the spread of COVID. Those are my general sort of messaging in and around COVID. If anyone has any questions, please let me know. We do have a website that you can go to. As I mentioned, if you go to www.nyc.gov, you can go, that's our health department website to the public, and you can get all the information around testing and vaccinations and all of that stuff. And it'll also take you to the links that we have to set up appointments. Yes, thank you, Gabrielle.
Hi.
Go ahead.
Hi, I'm Geneva. Hi, I'm Geneva from Zaina Loren Community Food Pantry and also Muhammad Ali Islamic Center. I have a question. Are pantry helpers, to include staff and volunteers who are helping to distribute food, as well as the spiritual leaders, are they part of the people who are eligible to get the vaccines?
At this time, those groups, those individuals are not part of the criteria group at this time. Hopefully they will be soon. I know there's a lot of talk around including, you know, essential workers such as community health workers and CBOs and things of that sort, which I believe a food pantry would fall under. But at this time, there's no particular, like, the criteria is not set up for those to be priority, nor for just in general, like congregants or clergy or anything like that.
Okay. Thank you.
You're welcome.
Do we have any more questions at this time? We've got a question. Could you please clarify if the rules around insurance apply to both public and private vaccine sites?
Yes, so I definitely know they obviously apply to our sites. I have not been in meeting spaces with those that might be contracted privately to do some of this work, but I can tell you my experience from doing testing, you know, in the spring and over the summer, is that private is usually always going to ask you and be pretty adamant about you giving your health insurance information if you have health insurance, right? I think when we did testing, when the health department was responsible for doing testing, and even H&H, and now at the vaccine sites, like we're going on sort of the honor system that if you tell us you don't have insurance, we're going to document you don't have insurance and move forward. That should be the case for private partners. But my experience has been, even with the testing, that they have been a little bit more aggressive about collecting that data if and where possible.
Thank you, Lou.
No problem.
A follow-up question around that would be, if insurance might get billed, would you know if that would be for just the administrative fees or for the vaccine itself?
That's interesting. I don't really know the answer to that. I want to say just I want to say like administrative and injection fees, right? Because they're not paying for the vaccine. The vaccine's actually coming from the federal government.
Right.
So I feel like it should only apply to administrative. And I think, you know, like some healthcare providers charge injection, like it's rolled up into whatever they charge your insurance, but there's like an injection fee. When you get, anytime you get an injection, you could probably get a breakdown and you'll see that there's an injection fee, even when you get the flu shot. So I would assume that if they're billing your insurance, they're billing it for the administrative fees and some of the other healthcare related costs, you know, aside from the vaccine itself.
Great, thank you. That's a question we got yesterday that was hard for folks to wrap their heads around. Thank you.
I know they did that with the testing too. Like, so if you went to like CityMD site, some people were there who gave in their insurance. CityMD like billed certain admin and healthcare related cost fees to the insurance, even though they weren't billing for the actual test itself.
Okay.
The test kits they were getting from us.
If we don't have any more questions at this time, we do have a few more minutes where I can go through some COVID-19 vaccine resources, some of which Lou mentioned. All right, so this is one of many fabulous posters that the Department of Health has put out. This is a short 2-page flyer of what New Yorkers need to know about the COVID-19 vaccines that answers some of the most frequently asked questions. And this one was updated as recently as January 13th. You can access it via the link at the bottom of this page. What older New Yorkers need to know, sometimes we're getting specific questions from the older members of our community about what will be safe for them after the vaccination. How do they get their appointments? Those are often the folks that need the most support. There's also a more in-depth page on frequently asked questions. It's where we got a lot of the information for this PowerPoint. And some additional resources to learn more about the vaccines include the CDC and the DOHMH's page on COVID-19 vaccine data. For making an appointment, you can use all of these links here to figure out your eligibility and exactly where to go to sign up, etc. We've already had time for questions. Of course, it's still open if you have anything more to ask, but otherwise, I'm done with our content. I want to thank you for being present today, for your listening ears, and for all of the helpful input that you've shared from your experiences in your communities throughout the pandemic. You all are the experts on this, and I really enjoy learning from you. We'd appreciate if you can fill out the evaluation form. This really helps us to improve our content moving forward. And you will receive a PDF of the webinar. I want to give another thank you to Masab Sadia for the support of Majlis Ashura, and to Arif Yusuf for the support of Islamic Relief USA, and of course to Lou Rivera from the Department of Health and Mental Hygiene, Office of Emergency Preparedness and Response. Thank you for all of the wisdom you shared with us today and for your ability and willingness to answer the questions that came up.
You're very welcome, and I always appreciate the opportunity to come to these events. It's been some time since I've been able to come to one of NIDIS's events, but I just want to thank NIDIS because we've had a long-standing partnership with them, at least since I came to the health department and even before that. But thank you for all the hard work that you guys are doing to make sure that houses of worship and the faith sector has access to this information and understands how to move forward with some of this, because it can get very complicated.
Yep, and I also just want to say thank you guys for facilitating the seminar. It was really, really well done and very, very great information for our community. So thank you very much. Really do appreciate that.